My name is Dr. LaMar Hasbrouck. I'm the director of the Illinois Department of Public Health. And I am one in a long list of champions for the cigarette tax. And we're going to talk about that just a little bit. And quite simply, if there is a public health initiative that can result in 60,000 people quitting smoking, that can result in 60,000 deaths avoided, that can result in decreasing the number of youth that may start smoking by 80,000, while stabilizing a very important and crucial safety net of Medicaid in our state, then I will buy that for $1. So with that, I'm going to introduce a Dr. Chaloupka. He is a distinguished professor of economics at the University of Illinois, Chicago. He directs the Healthcare Policy Center, and he is an expert, an eminent expert, on the issue of the impact of cigarette taxation policy on smoking, economics, and health. Dr. Chaloupka, please.
Excuse me. As was indicated, I'm a professor of economics at the University of Illinois in Chicago. I've been working on tobacco tax policy for the last 25 years. So I've done a lot of research looking at the effects of tax and price changes on kids taking up tobacco use, on adults quitting tobacco use. And it's really clear from the research that I've done, from the evidence that we have from experiences in other states, other countries around the world, that tobacco tax increases are what I would consider a win-win-win. It really makes a lot of sense from an economics perspective. The tax is going to generate significant revenues. We estimate that the dollar per pack increase in the cigarette tax will generate about $377 million in new revenues this year. Estimate that raising the taxes on other tobacco products to the point where they're equivalent to the cigarette tax, so effectively doubling the tax on other tobacco products, would generate almost $40 million in additional tax revenues. And then we're going to also save significant money when it comes to the money that we spend on the healthcare costs associated with treating the diseases caused by tobacco use. Every year, the state of Illinois, we spend almost $5 billion treating diseases caused by tobacco use. $1.8 billion of that comes out of the Medicaid system. So when we raise the tax, we're going to see reductions in tobacco use. We're going to see, as a result, reductions in the diseases caused by tobacco use and significant savings to our healthcare system in the states, not just the state Medicaid program, but private savings as well. We'll also see significant reductions in the other economic costs of tobacco use. The death and disease that are caused by tobacco cost the states another $5 billion a year in lost productivity, as people aren't going to be able to work. We'd see, again, reductions in those economic costs. So it makes good economic sense to raise the cigarette tax, reduce healthcare costs, generate revenues, reduce the other economic consequences of smoking to the states. It makes really good public health sense. The work that I've done shows that kids are very responsive to increases in taxes and prices. If we raise the cigarette tax in Illinois by $1 a pack, I estimate that over 77,000 fewer kids will take up smoking among the current population of kids that we have in the state of Illinois. So 77,600 fewer kids taking up smoking because of the dollar tax increase. It's also going to be very effective in getting adults to stop smoking. Estimate that almost 60,000 adults would stop smoking as a result of the dollar tax increase. And because people stop smoking, because fewer kids take up smoking, we're looking at really significant public health benefits. Almost 60,000 fewer Illinoisans would die from diseases caused by tobacco use as the result of a dollar increase in the tax. So good economic sense, good public health sense, and then it makes sense politically. One of the things that we see is that people really do support cigarette taxes. We may have a lot of anti-tax sentiments in this country at this point, but cigarette taxes really differ from other taxes, especially when people understand that the tax is being used as a public health tool. So we see from the polling data in Illinois, for example, that 74% of voters support a cigarette tax increase, with the revenues that are generated by that tax increase going to help support the Medicaid program in the states. And then the interesting thing to me is we see a significant number of smokers themselves actually supporting a tax increase on cigarettes. We're looking at 4 in 10 Illinois smokers supporting the dollar tax increase. Again, they understand the consequences of smoking most clearly. They understand how effective the tax would be in keeping kids from taking up smoking. So a political win in that sense. So again, a real win-win-win situation, something that makes economic sense, something that makes political sense, and something that makes sense from a public health perspective. Thank you.
So again, just to put this into perspective, the state where I'm coming from, New York State, has a cigarette tax of $3.45 per pack. The average tax in the country is about $1.45. The Illinois cigarette tax has not been increased for 10 years. So again, it is a win-win-win situation. At this point in time, I'd like to introduce Leader Curry, who's one of our champions from the Senate.
Thank you very much, Dr. Hasbrouck. I am Barbara Flynn Curry. I'm a state legislator from the south side of Chicago and the majority leader of the Illinois House. It is my pleasure and my honor to be the sponsor of the bill that will stop 77,000 teenagers from taking up smoking, will encourage 60,000 grown-ups to stop, and will save at least 60,000 lives because the air will be cleaner and people will have better, healthy habits. This money will go into the state's Medicaid program. The Medicaid program serves people who are not able to pay the health care bill themselves. This program, the Medicaid program, is in very serious need of shoring up. So the value of the cigarette tax increase is the value of making sure that we can continue to pay the health care costs for people who do not have resources of their own, but it also means we will have a healthier, a longer-lived public in the state of Illinois, and I just hope that, that the votes will be there to get this job done. Thank you very much.
Once again, I believe that this is prudent public policy. This is obviously a public health initiative. Tobacco prevention is a tenet of public health the world over. And if, once again, we can decrease the amount of deaths by 60,000, get 60,000 people to quit smoking, and prevent 80,000 young people from being replacement smokers, I'll buy that for $1.